Hi, my name is Alyssa. I'm going to be doing a IV medications, primary IV medications via IV mini bag. I'm going to check my doctor's orders first. He has ordered me 1 gram of Rocephin over 30 minutes every 12 hours, which is a safe dose. I have available 500 milligrams per milliliter. So that would mean I would draw up 2 milliliters of IV fluid. So I'm going to go ahead and start with that. I'm going to verify the expiration date on my medication. It's good. I'm going to clean the top off. I'm going to draw up 2 milliliters of fluid now. Or 2 milliliters, sorry. Okay, so now that I have my medication, I'm going to insert it into my mini bag, my new mini bag. I'm going to put this in the Sharps container. I'm going to mix up my IV fluid. And then on the back of the IV bag, I'm going to put a label with my initials, the patient's name, the medication, the dose, and the date and time. Now I'm going to draw up my saline to flush the IV. Going to clean the top, check the expiration date, it's good. I'm going to draw up 6 milliliters of saline. Excuse me. Sorry about that. I'm going to go ahead and draw that again. Why don't we just go ahead and pretend this? Okay, so now I'm going to recap that until we go to our patient's room. And next thing I'm going to do before we go ahead and see our patient is connect our tubing to the IV bag. I'm going to make sure I maintain an aseptic, sterile and then making sure my tubing is also clamped. And I'm going to turn it up, or if I didn't mix up my medication, I was going to do that now. And I'm going to prime my drip chamber halfway. Now what I'm going to do is prime my extension tubing. I'm going to hang it from the IV hanger. And unclamp it. Just let gravity take its course. So now that my extension tubing is primed, I'm going to clamp it again hang it from the bag. And then we are going to go to the patient's room now. So I'm going to knock on the door. Knock, knock. Hi, my name is Alyssa. I'm going to be your nurse today. The doctor has ordered you a gram of Rocephin for your infection. So I'm going to go ahead and verify your ID band with your name and your date of birth. I'm going to do my hand hygiene. I'm going to put on my gloves. Put on my gloves. I did the wrong way. Okay, so now that I have my gloves on, I'm going to go ahead and check the insertion site for any phlebitis or infiltration. I'm going to palpate for any tenderness. The next thing I'm going to do is make sure our port is clamped. And I'm going to clean the hub. Are you allergic to any medications? No? Good. Okay, now we are going to hook the tubing up. And we're going to unclamp and aspirate for blood return, which we did. So now I'm going to, using the push-pause method, insert 3 milliliters of saline. And now we are going to unhook and place this here and clamp it. Oh, sorry, we're not going to. We're going to clamp it again using positive pressure. Okay, so it's clamped. And now we're going to unhook it. Okay, the next thing we're going to do is check our drop factor. My drop factor was 10 for my tubing, so it would make it my drops per minute to be 17 because I have 50 milliliters of solution in my bag and I'm administering over 30 minutes times 10. So I'm going to go ahead and unclamp my tubing until I see my drops. And I'm going to count for 30 seconds until I have about 7 or 8 or 9 drops in 30 seconds to make it 10 or to make it 17 per minute. The next thing I'm going to do, and this is still clamped right here, is to clean our port, unhook the alligator clamp that would be on here, clean the port, clean this port, and attach it. We're going to pretend that didn't come out because it should be attached by a techoderm. We're going to unclamp his tubing. We're going to unclamp our tubing here, and let the medication fall. I'm going to come back in 30 minutes and check on our patient again, and once this is done, and I'm going to come back. So before I leave, I'm going to go ahead and make sure my patient is comfortable. He has all his possessions in place. He doesn't have to go to the bathroom. He's not in any pain, and his bed is low, and that's it. So I'll be right back. Okay. So it's been 30 minutes now. We are back to unhook our I'm going to go ahead and clamp off his port. I'm going to clamp off this one, although the medication should be done running. I'm going to assess again his area for any phlebitis or infiltration and tenderness. I'm going to take off our tubing, place a brand new alligator clamp on it. I'm going to make sure I've labeled this tubing with my initials, date, and time of when I first administered the medication. I'm also going to clean this port again. I'm going to attach the needleless syringe of saline, going to unclamp, and I'm going to push pause again. And clamp it again. I'm going to remove it. And now that we are done and his IV has run through, I'm going to make sure he's comfortable again, make sure his call light's in reach and his bed's low. Make sure he's gone to the restroom and he doesn't have to use the restroom. Assess his pain, see if he has any pain, and make sure and that's it. And then make sure his possessions are within reach. Now that I've finished with the IV, I'm going to go document. I'm going to document the route, dosage, the location of the IV, its condition. I'm also going to record this intake of the medication and how the patient tolerated the procedure. Thank you.